Good morning.
Good morning, sir.
I'm unable to hear
I'm
you.
unable to hear
Uh,
you.
write in the chat
Write in the
box if
chat box
I'm
if
audible or
I'm
not.
audible or not.
Because I'm using the
Because I'm
microphone, so
using
I'm
the
unable
microphone,
to
so I'm
hear
unable
you.
to
As
hear you.
most of you are
As
not attending live classes, so I started using this microphone instead of that uh, earphone. If I'm audible clearly, please write in the chat box. Okay. Thank you, Anirban. So, if any question you will have during the class, please raise your hand and ask me. Good morning. Okay. So let us start. I hope you have gone through the previous lectures which we have discussed in last few classes. It has been 2 classes since we are discussing mental diseases. In the last 2 classes we have discussed introduction and this 215 and 216 aphorism. 215 was regarding definition of mental disease. What is mental disease? We have told that mental disease is nothing but a one-sided disease, chronic disease. It is in chain that one-sided diseases. There Hahnemann have started discussing one-sided diseases, and now we have reached to mental one-sided diseases. Previously, we have said that one-sided diseases may be physical, may be external, may be internal. Now, that internal may be of physical nature, one-sided pain, migraine, cardialgia, like that. These are of internal physical nature. Then it was of external nature, external diseases. Now we are discussing internal mental one-sided diseases. Okay, these are also a branch, a type of chronic diseases. Due to chronic diseases, Hahnemann is saying at one place that it is sora, which is the soil behind these kind of mental diseases. Okay, and we know by our study of miasm that it is actually the more dominancy of syphilis miasm, until and unless it is not going to neurosis. There are broadly mental diseases can be classified into types: neurosis and psychosis. Neurosis is where the patient lost a touch with the reality. Okay, that is neurosis. That is psychosis. And neurosis where the patient is still in the touch with the reality. So cases of neurosis may be predominantly soric in nature. Okay, getting it? Cases of neurosis may be predominantly of soric nature, but cases of psychosis where the patient has lost the touch with reality, lots of hallucination, lots of delusion are there. So these kind of cases are actually falling under predominant psychosis, syphilis miasm. Okay, if you are getting a history of psychosis in the family, psychosis means this psychological psychosis, not our psychosis, SY, it is PSY. So PS, that psychological psychosis. Okay, so if you are getting the history of insanity in the family, one of the if you are getting the history of what you call that insanity, schizophrenia. Okay, if you are getting a history of what is schizophrenia, it is one of the, is it falling under psychosis, not neurosis. So if you are getting a history of schizophrenia in the family, it is most probably a syphilitic dominant, indicating a dominance of syphilis. Okay, so Hahnemann is telling mental diseases are of soric nature, but we are, after studying our miasm, we have developed an attitude that it is mostly a syphilitic predominance if it is of psychotic nature. Okay, not of neurosis. We have broadly described mental diseases in neurosis and psychosis. Psychosis is where the patient have lost the touch with the reality, and neurosis is where the patient is still in the touch with reality. Okay, and now you will get cases of anxiety, cases of depression, depressive psychosis. Okay, cases of anxiety neurosis, these are predominantly soric nature. Okay, these are also mental diseases, but predominantly soric nature, because here the patient have not lost the touch with the reality. And cases of depressive psychosis, where the patient is on the borderline, and it is the patients in depressive psychosis who will commit suicide. Okay, patient with depressive psychosis will commit suicide. And what this indicates a predominantly syphilitic miasm. Okay, love of self is most instinct, the most strong instinct a person may have, and if he has lost the love of self, love of life, what kind of miasm it may be. Okay, what kind of mental disease it may be. Okay, it is a deep-seated mental disease where the patient have lost the touch with the reality, lost the self-love. Okay, so if you are getting the history of insanity, getting the history of suicidal death, it indicates predominance of syphilitic miasm in the history. Okay, so aphorism number 216 is dealing with the first kind of mental diseases, where Hahnemann is telling that the bodily diseases decreasing and mental symptoms increases. We have discussed in the last class. Okay, we have discussed how Hahnemann have discussed at some place that tuberculosis is decreasing and mental symptoms are coming. At aphorism number 38, you will see, still you will be observing, these are facts. We have at some point of time we have discussed that these are the why Organon is still relevant today, because these are based on facts, observation. What Hahnemann have observed, you still can observe. Okay, if that practice is still there, you can still observe these kind of cases. Okay, if Hahnemann have observed that at point of time physical diseases are decreasing and mental symptoms are coming back, still you can observe these kind of cases. One of the most common case you will encounter is postpartum psychosis. Okay, where all of a sudden physical symptom of lochia suppressed and mental symptoms come up, mental psychosis come up, depression come up. Okay, what is this? This is the one-sided mental diseases. This is first kind of mental disease where the physical symptom suppresses and the mental symptoms are coming up. Okay, so you still can observe these kind of cases. Tuberculosis, because of the advanced treatment of tuberculosis with antibiotic, these cases of tuberculosis where mania occur are uncommon, but these are observable, still observable. Okay, are uncommon due to advanced treatment, but still observable. So Organon is still relevant because of its observation of facts. What Hippocrates at his time observed and wrote the symptoms of tuberculosis. The interpretation of that phenomena may differ. That we have discovered that yes, there is bacteria who is causing these and that. The interpretation of phenomena may differ, but phenomena remains the same. Okay, that is why Organon is still relevant. Okay, so aphorism number 216 we have discussed in last class. We will discuss aphorism number 217 onward. 217 is dealing with the case taking. Okay, first one type of mental disease has been discussed. Next, the case taking, the mode of treatment will be discussed. Okay, this is the pattern Hahnemann have followed everywhere in Organon. In case taking, during the sections on case taking, Hahnemann have discussed case taking in detail. But in other sections where Hahnemann is discussing about different type of diseases, there also Hahnemann is discussing case takings. Okay, there also Hahnemann is discussing the mode of treatment. Okay, now 217. In these diseases, follow 217. I am reading this. I hope I am clearly audible. If I am not audible, if some point you are unable to get, please raise your hand or write in the chat box. Chat box is in front of me, you can ask. Now, in these diseases, we must be very careful to make ourselves acquainted with the whole phenomena. Okay, we have discussed what is phenomena, what is noumena in the very beginning of our classes. The whole phenomena, underline this, both those belonging to corporeal symptom. What is corporeal? Bodily symptoms. And also, and indeed, particularly those appertaining to the accurate apprehension of the precise character of the chief symptom. Underline this. What is chief symptom here? What is the characteristics of one-sided disease? There is a chief symptom. Okay, characteristics of one-sided disease is that there is a one chief symptoms which is obscuring all other phenomena, obscuring all other symptoms. So here chief symptom would be mental symptom. Clear? So also indeed particularly those of appertaining to the accurate apprehension of the precise character of the chief symptom. Underline this. Chief symptom meaning by the mental symptom of the particular and always predominant state of mind and disposition. Okay, predominant state of mind and disposition. Clear? Disposition. What is disposition? Disposed to be irritated. He is not irritating. Irritation is a mental symptom, but disposed to be irritated. Disposed to be irritated. He is disposed to be irritated, disposed to anger, disposed to depression. Okay, this is disposition of a yielding disposition. Yielding disposition is a symptom of disposition. Okay, not a mental symptom. Crying, weeping is a mental symptom, you can tell, but yielding disposition, it is that easily convincible. You can convince that person easily. Yielding disposition, pulsatilla. You can convince a pulsatilla easily. He is telling no, 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 and after your coaxing, after your conversation, he is convinced. Though yes, okay, this is yielding disposition. So symptoms of mind and disposition. In order to discover the purpose of extinguishing the entire disease among the remedy, in order to discover what you are going to discover, you are going to discover the medicine. We have give this analogy many a time. We have given this analogy that this is the symptoms of disease. This is the symptoms of disease. Okay, this is the symptoms of medicine. Okay, you are knowing this by case taking. You are knowing this by your materia medica, study of materia medica, or study of drug proving, or by drug proving. You are knowing this, and now you are going to match. So you are discovering this is, you know, but this you are discovering by what? By what? Is this you are discovering by what? You are discovering by case taking. Case taking, case taking, case taking, case taking. Suppose you are unable to discover during case taking, you are just getting this symptom, one symptom. How you will match? How you match? This is one-sided disease. Okay, you are unable to discover this. This is one-sided disease. Again, this is the medicine. Symptoms of medicine. You know by your study of materia medica. You know by your study of drug proving that these are the symptoms. This you know. But this you are here. Patient came and you are uncovering the patient. Discovering the symptoms of patient. Okay, suppose you are unable to discover, you will be unable to cure because you know this, but you don't know this. How you will discover? How you will match? You know this, but you don't know this now. So this can be due to your incompetency, that you are unable to drain your patient, unable to take the case. You are lacking the skill of case taking. This can be your incompetency. Okay, but this can be due to low vitality of patient. Okay, you are discovering just one symptom. This is the chief symptom patient is telling. This is the chief symptom patient is telling. This is, again, you have to proceed. No, you have to proceed with this symptom, available symptom. So this is one-sided disease, one-sided disease. And in these cases, what you will do, you will try and discover as many symptoms as possible. Try and discover as many symptoms as possible. Discover, okay, and then this is matching. This is the business of physician, knowing the disease, knowing the medicine, and application. Business of physician, knowing the medicine, knowing the disease, and application. This is application. Okay, so in order to discover for the purpose of extinguishing the entire disease among the remedy whose pure effects are known, a homeopathic medicinal pathogenetic force. See, this is the pattern of Organon. You have to bear with it, that instead of telling one medicine, he is using 10 words. You have to bear with it and read. That is to say, a remedy. क्या जाता अगर remedy शुरू ही में बोल देते, तो he is using 10-12 words for coming to a single point. Okay, this is the pattern of Organon. This is what making Organon difficult, which in list of symptoms display with the greatest similarity, possible similarity, not only to the corporeal morbid symptom present in the case before us, but also especially this mental and emotional state. Again, mental and disposition. Emotional state is disposition. What kind of disposition is having? He is not weeping. When he is weeping, when he is crying, it is a mental symptom. But yielding to dispose to weep, you will get many symptoms in your Metria Medica. Weeping disposition. What is this? What is this indicating? This is indicating a emotional state. Ab ro dega. Okay, easily weeping. This is the disposition. I hope the disposition is clear. I hope the emotional state is clear. What is emotional state? This is disposition. Disposed to anger, disposed to irritation, disposed to quarrelsome. Okay, झगड़ा कर रहा है. Okay, झगड़ा कर रहा है when he is quarreling, he is abusing. These are the mental symptoms. Okay, but disposed to quarrel, डॉक्टर साहब हमेशा झगड़ा कर लेता है. Disposed to quarrel, this is the emotional state. Okay, this is the emotional state. Now, to this, now 218, to this collection of symptoms, belongs the first place the accurate description of all the phenomena. Accurate, what it includes, what it will include. Okay, what it will include. Wait a minute, I will come. Wait a second. So here again, Hahnemann is talking about case taking. Okay, what it should include? What should it include? It includes at first place the accurate description of all the phenomena of the previous so-called corporeal disease. Okay, of the previous so-called corporeal disease. Previous so-called corporeal disease means the disease which were present before tuberculosis. Okay, was there, all of a sudden it suppresses and that symptoms come up, flare up, mental symptoms flare up. Okay, so this is the previous so-called corporeal disease before it degenerate into one-sided increase of psychical symptoms and became a disease of the mind and disposition. Again, everywhere you will see mind and dispositions are being used. This may be learned from the report of patient friend, as patient will unable to tell you. Patient is in psychosis, patient is in mental, patient is giving mental symptom, patient is in the period of insanity. How he will be able to tell what all the physical symptoms were present there before? Okay, So learn from the report of the patient's friend. We have learned the sources of symptoms, patient himself, physicians himself, and patient's friend and relatives. Now, aphorism number 219 is important because it is dealing with the lucid interval. Dealing with the lucid interval. Lucid interval is one of the famous question for your MCQ examination in your PG entrance examination. Lucid interval 219. Remember, there are some aphorisms which is containing a single terminology and that are important for direct question in your PG entrance examination. If you are unable to locate that aphorism, this is a crime. You should learn where the indisposition have been discussed. You should learn where the lucid interval have been discussed, where the primary symptoms have primary action has been discussed, secondary action have been discussed. Okay, so these are the single terminology where these have been referred. You should remember them. Alternating action, you should know. Idiosyncrasy, where idiosyncrasy is there, you should know. Alternating action is 115, idiosyncrasy is 117, and lucid interval is 219. All these are actually in odd number, so it will be easy to remember for you. Okay, there is indisposition in aphorism number 150. This is not odd. Okay, this is not odd. Remember, 150 is dealing with the indisposition, 115 alternating action, 117 idiosyncrasy. Indisposition is also in aphorism number 7 footnote, and 150 also. Okay, 150 and 150 indisposition have also a name which is called also other name. What is that? Indisposition have also an other name. What is that? Open content 150. Mimicking sickness, good. Mimicking sickness, Kent gave it the name mimicking sickness. Okay, and go to 150, and there you will see that slight ailment. Okay, so these are important for your PG entrance MCQs. Now coming back to 219. 219 is dealing with the lucid interval. 219 is dealing with the lucid interval. A comparison of these previous symptoms of corporeal disease with the traces of them still remain, though they have become less perceptible, but which even now sometimes become prominent when a lucid interval and a transient elevation of the psychical disease occurs. Okay, lucid interval will serve to prove them to be still present, though obscured. Okay, some symptoms are present still but obscured. That is why Hahnemann is telling at one point of time, Hahnemann was telling the master of observation. Okay, this obscurity of symptoms may be there. A patient was unable to narrate. Why? Because mental symptoms were there. This is for the mental symptom. Now patient was unable to narrate. One more reason is there, because this is not troubling the patient. Okay, that is lesser accessory symptoms. Symptom is there, but patient is unable to tell you because it is not troubling. What is troubling the patient? Patient is troubled with chief symptom. Okay, patient is troubled with the main symptom for which he has came to you. That is what Robert Toll told wrap of the fabric. This is the main symptom, but personality is inside the patient. The prescription may or may not be on the chief symptom, but this is the chief symptom and this is the patient. Patient is coming with you with this wrap. If it is testing your case taking skill, how far you are able to remove this wrap. If you are able to prescribe on these chief symptoms, well and good, but many often it has happened that you are not able to prescribe on this wrap of the fabric and you have to remove this wrap, and you ask your patient technically you are asking your patient to remove that rap, and that needs the skills of case taking, and that needs the power of observation. If it is present outside, you can observe easily. Okay, so master of observation will definitely observe these obscure symptom also. Okay, like physical irritability of nitric acid. What is this? Physical irritability. You will see this Allen's keynote. Physical irritability. Nitric acid. Open nitric acid. 1, 2, 3, 4. Fourth paragraph. What is there? Excessive physical irritability. What is this? Everyone cannot observe this physical irritability. One of our teacher prescribed nitric acid on the basis of this physical irritability, and this falls to his eye only, because he was the master of observation. Like patient was telling, always this is a sort of tick. Okay, patient will always like this. This is a sort of tick. Okay, this is also a mental symptoms, but not easily. If it is very prominent, patient is always doing this. If it is very prominent, you will be observing this physical irritability. But if it is not prominent, like this, no reason why he is doing this. This is physical irritability, a mental symptom, but on a physical plane. So these are the symptoms which are obscure often and needs the master of observation to observe it. So try to cultivate this habit of observation. There is a article by Hahnemann called Medical Observation. Read that article. Medical Observation. In the lesser writing, it is available in the lesser writing. Medical Observation. Okay. I will tell you one point from that. Medical Observation is an article of Hahnemann in this lesser writing. Give me a minute. Give me some minute. If it is there. Observation upon the ordinary, preparatory and accessory treatment. No. Medical observation is an article. Okay, I'm not getting it right now. I will search it and share with you. Okay. So these are the power of observation plus skills of case taking you need to develop. Okay. The materia medica you know, but this you don't know. So how you will do the application. So skills of case taking you have to develop. You have to open up your patient. Now, so 219, 220. 219 is dealing with the lucid interval. 220. By adding to this state of mind and disposition, accurately observed by the patient's friend and physician himself. Underline this. By adding, underline, state of mind, underline, and disposition, underline, observed by the patient, friend, and physician himself, underline this. Now, we have constructed, what we have done, we have constructed a complete picture, for which in order we have constructed a complete picture, for which we, in order to effect the homeopathic cure of the disease, a medicine capable of producing strikingly similar symptoms, especially an analogous disorder of the mind, must be sought for among the anti-psoric remedies. Okay. Now, most especially an analogous disorder of the mind, especially that medicine should match with the mental symptom of the patient. Okay. From the anti-psoric, Hahnemann is telling anti-psoric. Okay. Underline this, anti-psoric. But we know that you can discover a medicine of anti-tubercular or anti-syphilitic also. Okay. if the psychical disease have already lasted some time. Underline this. If the psychical disease have already lasted some time. Lasted some time, that means it is a chronic one, and from here onward the next aphorism starts. Lasted some time. If the next aphorism 221, if however insanity or mania have suddenly broken out as an acute disease. This brings us to the second type of mental disease. This brings us to the second type of mental disease, that is the mental disease of acute origin. Mental disease of acute origin. If however insanity or mania, in bracket what is given? Caused by fright, abuse of spirituous liquor. Okay, these are abuse of spirituous liquor is mania, this delirium. Okay, recently a case in Ludhiana was there. The patient admitted with the alcoholic delirium tremens and died. The doctor was arrested. Okay, there fault of doctor. There are chances of delirium tremens to result in death. So delirium tremens, this is of acute nature, caused by vexation, abuse of spirituous liquor, and etc. It may be caused by what? Sun heat. I think in natrum carb. In natrum carb, most probably in natrum carb, Nash discusses after natrum carb, roaming in the sun whole day, the mania developed and it was cured with the natrum carb. You will get in Nash. Okay, you will get in Nash. Natrum carb, mania roaming in the sun whole day. So these are the acute burst out, acute manias because of those exciting sudden fright, sudden vexation. Okay, this shows what the patient was at the verge of insanity. You will see patient that thinking that I will lose my mind, insanity. Okay, and there are patients who are, you discover, you know that he is at the verge of developing psychosis. He is at the verge of developing schizophrenia. Okay, so a bit of anger, a bit of fright pushed the patient to the world of psychosis where he lost the reality. If however insanity or mania caused by fright, vexation, abuse of spirituous liquor, etc. have suddenly broken out as an acute disease in the patient's or calm state, almost always arises from internal sora. Underline this. These acute diseases are also always arises due to internal sora. It yet occurs in this acute manner. It should not be immediately treated with antisoric. Underline this. Okay, same have been discussed in skin diseases. Okay, should not be treated with immediately with the acute with the antisoric, but some asoric medicine. Same been discussed in intermittent diseases with some acute diseases. Same thing have been discussed here in mental diseases with some acute diseases, and same thing we said acute explosion of latent sora, a type of acute disease. There are many types of acute disease we have discussed in aphorism number 73. That type of acute, individual acute diseases coming from explosion of latent sora. Okay, and you need acute diseases for these kind of acute medicines for these kind of acute. So the use of aconite, rustrox, brina. Okay, and these are acute diseases of a small act. Okay, but to prevent those relapses, you need to treat the chronic miasm which is responsible for their explosion. Same here for the acute mental disease. You are treating the acute mental disease with acute medicine like belladonna, like stramonia, like hyoscyamus. But once this acute state subdues, once this acute state goes to normal, goes to a calm state, you need to treat with your anti-miasmatic medicines. Clear? Same thing everywhere. In skin disease have been discussed, in intermittent disease have been discussed, in mental disease have been discussed, and we are adding to that acute diseases coming from the explosion of latent sora. And there are a type of acute diseases which are due to acute miasms. Okay, there are acute diseases due to acute miasms, once in a lifetime occurring or recurring. These are fixed in character and need fixed remedy for their. Okay, that is totally a different thing. Don't confused with that. Now, but in the first place, with the remedy indicated for it out of the other class of proved medicaments, other class of proved medicament, same meaning. Aphoric medicines, same. Other class of medicines, same meaning. In bracket, aconite, belladonna, stramonium, hyoscyamus, mercurius. Mercury is also given here. Okay, so one of the indicating one of the syphilitic predominance also. Though mercury is not an acute medicine of short duration, but remember you can use any medicine in depending upon the symptoms. One of the interesting point coming to my mind which I want to share with you is that when you are getting an acute case, you are getting indication of medicine. Okay, what I'm telling, in acute case, if you are getting indication of some chronic medicine, remember that cases of grave nature, because those deep-seated symptoms are showing up on the surface. Okay, you are getting in pneumonia, you are getting the symptoms. You know the lycopodium is a deep acting medicine. You are getting the symptoms of carcinosin in acute cases. Remember, these cases are should deal with okay, because these are the grave cases. These are the observation of stalwarts. That, and I have confirmed it in some cases that in acute cases you are getting the symptom. You are getting the symptoms of lycopodium. That means a grave condition. The symptoms of constitutional nature are coming up. Okay, so when guys, minute homeopathic dose in order to subdue it, for that the sora shall for the time revert to its former latent state. Okay, acute expulsion maybe at the physical plane, maybe at the mental plane. So you are giving medicine, give your medicine or not, this is going to subdue. Okay, where the patient appears quite well after your acute medicine. Everywhere you have to do this. Everywhere you have to do this. You have to give your patient relief in acute conditions. Now, aphorism number 22. 1 onwards starts the second type of mental disease. Okay, 15 was there. Sorry, 15 there. Aphorism number 215. Once, give me a second. Okay, aphorism number 215 was there. Sorry. Aphorism number 215 was there for what? Definition. Okay, from 216 onward, 216 started what? From 216 started the first kind of corporeal type. Okay, from corporeal to mental symptom. 216, 217 dealing with case taking, 218 dealing with the case taking, 219 dealing with the case taking. Now 220 was dealing with the prescription. What you should, so 216 to 220 is what? 216 to 220 is what? The first type of mental disease. Now next mental disease starts from 221. Okay, 221. Next type of mental disease start from 221. 221. Now 222 with treatment. 223 is dealing with treatment. That means 221 to 223 3, what it is dealing with? It is dealing with the mental disease of acute. Okay, so if you in your examination, if you have been asked about types of mental disease, it will be easy for you to give the reference with the aphorisms. Okay, up to 223 mental treatment of mental disease of acute nature. Okay, to all these you will add aphorism number 228, aphorism number 229. What is this? To all that treatment, all the 4 kind of mental diseases needs this 2 aphorism. Aphorism number 220, aphorism number 229. What are those? Auxiliary mental regime. Auxiliary mental regime for the mental patients. Okay, so whenever you are asked the mental diseases and their treatment, divide your answer in this manner from 221 to 223, and when it's dealing with the acute mental diseases and their, and to this you have to add 228 and 229. And mental diseases of corporeal origin is started from 216 going to 220, up to 220. Treatment and definitions are there. Now to that you will add 228 plus 29. Okay, all 4 kind you have to all add these. Okay, now coming back to our topic. Wait a second. Coming back to our, which is 222, aphorism 222. Aphorism number 222. But such a patient who has recovered from an acute mental or emotional disease, use of these antipsoric medicines, non-antipsoric medicines, should never be regarded as cured. Underline this. Should never be regarded as cured. There is a footnote to it. Read it by your own. By means of a prolonged antipsoric should, or on the contrary, no time should be lost in attempting to free him completely by means of prolonged antipsoric treatment. Underline this. Prolonged psoric treatment. Underline this. Now, from the chronic miasm of the psora, which it true has now once more latent, but is quite ready to break out anew. There is a chance of attack again. There is a chance of attack again. This is be done. There is no fear of another similar attack if he attended faithfully to the diet and regime prescribed for him. Underline diet and regime. Diet and regime. I'm in NIH boys hostel. In every batch, there was a patient of acute mania because of harsh ragging happening there. Once in our batch, there was a student who was actually a diagnosed case of schizophrenia, and he was taking medicines for his bipolar, and due to ragging period, and all of a sudden due to irregular taking of allopathic medicine, medicines for his mania, and there was irregular in taking those medicines due to ragging, and there was harsh ragging by senior in NIH boys hostel. That patient, that student, our batchmate, one of our batchmate, developed that kind of mania, and he was running behind all the seniors, and there was a chaos in the hostel. Every senior was running for his life. Okay, and later on it was found that the condition has been due to this accessory circumstances, and there is a history of like that student seniors never learn. Okay, once they rag and the mania develop, again when they become senior, they again go to the dormitory, and again same kind of ragging is there. Again, one person got mania and running behind the senior. They never learned. At least for 3 or 4 consecutive years, there was history of acute mania until and unless that ragging was committed in NIH boys hostel. Okay, there are some good part to that ragging also, but some seniors are too mature, and because they were coming after wasting lots of their time. They were in second BHMS and in their, and students which were coming afresh, they were in their 17 or 18, like that. So there was a mismatch of mature seniors and juniors, and they were unable to correlate with this, and this mania developed. Okay, they were thinking that these juniors are like them. There were them also who are enjoying being dragged, but there were juniors who are of more sensitive natures. Okay, due to their tender age, teenage, and they developed this kind of mania. Thankfully, I was not for whole those ragging period. I just heard these stories from my batchmates. Now, so these are the conditions of acute mania which develop. One of the exciting vexation, okay, is developing this mania is vexation. Now, they should never be regarded as cured. You have underlined this, and prolonged. You should know this, underline this. Now, 223. But if antisoric treatment be omitted, when we may almost assuredly expect from a much slighter cause, you left between from a much slighter cause than brought on the first attack of the insanity, the speedy occurrence of a new symptom and more lasting and severe fit. If you omitted the antisoric treatment from slight, before it was much vexation, now a slight vexation will result in the mania. Sora usually develops itself completely and passes into either a periodic or continued medical derangement. Underline this, which is then more difficult to be cured by antisoric. Underline this, which is then more difficult to cure with antisoric. Okay, so you need a prolonged antisoric medicine. So in one-sided diseases also, you need a prolonged treatment. You need a prolonged treatment of antisoric. Successions of antisoric. That is why you take 6 years to completely cure a patient. Patient don't know that their disease, the burden of disease they are carrying is of generation, not of single generation, but 2-3 generations. And they are going to be freed of these chronic diseases for their next generation. Okay, any question you are having? We will start from aphorism number 224. Stay onward. Any question you are having, you can ask. You can write in the chat box, or you can directly ask. I am opening the microphone. Any question you are having, you can ask. Any question? So, I hope you have understand everything, or you have not understand anything. If no question asked, 2 conditions are there. You have understood everything, or you have understood nothing. Thank you for giving your attention. We will meet in the next.